Thank you very much, Ruben. Thank you all of you for being here this afternoon. Also, I would like to thank the International Hospital Federation and the Unió Catalana d'Hospitals that give us the opportunity to explain to you some initiatives of collaboration of networking in some of our hospitals with other hospitals in Europe, similar to us. As IHF is the European University Hospital Alliance, and I will try to answer this in 10 minutes. These 4 questions. Why we need more healthcare collaboration, new opportunities for the hospital that it is involved in the alliance. Until now, it's 4 years and a half. What has been the impact of the creation of the alliance, and where to start if you are trying to start with the hospital networking? What is the main factors that you have to take into account? So, the first item, why do we need more collaboration between healthcare providers? And this is to summarize, we as hospital managers, we have to face, as you know, many common challenges, but you have to realize that we cannot solve alone in only one institution. There is many questions of organizational transformation, of competence of different nurses, doctors, and many other jobs that are involved in the day square of our hospital. The challenge of digitalization that it's come in the present years and is going to be developed for sure in the following years. As you all know, all the economic pressures that CEOs will have to maintain and to try to provide with everyday's hospital, the everyday's hospital, and the progress of all the projects. And also there are some factors that affect every hospital in our country or in Europe, also with the factors that are involved in the globalization. Which opportunities does a collaborative network bring to the hospital? So some factors, some elements that I would like to underline. Learnings from similar organizations. For example, IHF is an alliance of, I will show you another slide, the 9 largest hospitals in Europe. So we have to, it is very interesting to know how in different countries and different big cities of Europe have to manage the problems that more or less are similar to ours. That bring us a fresh perspective of and specialized knowledge. Also, the alliance give us the opportunity to win funded projects with the European Commission that otherwise, if we were alone, it is more difficult to get these funds for specific projects. And our position is stronger to receive these European funds. And there are some examples that we have already won. And also develop new solutions to start projects with a cost and a risk sharing that it's low. It's low than if you were alone, and in this case. And there is also another question of influence to increase influence at some levels of political, I will say more of the health policy at the level of European community, that otherwise, if you were one hospital alone, this is practically impossible to do. So I would say try to perform a little bit like a lobby. How we created the European University Hospital Alliance and its impact. What makes some things or some factors that I will remark that makes university hospitals different or unique, I will say probably more things, no? But these four for sure. I mean, we're talking about attending patients, it's complex care of the patients. Also, the research, it must be included the research, basic, clinical, and the translational care into practice. And the fourth element, it's last but not least, and I would like to remark this, the education and training of our people, just future doctors and nurses mainly, but not only. And here are the 9 institutions that conform this alliance, this academic alliance. Here you can see the from Erasmus, from Rotterdam, Karolinska, from Sweden, Charité, de Berlin, the Hospital University of Vienna, l'Hospital San Raffaele de Milano, el Vall d'Hebron de Barcelona, l'assistència pública d'hospitals de París, el King's Partners de Londres, l'Hospital de Leuven a Bèlgica i l'Erasmus de Rotterdam. These 9 hospitals have the similar conditions. Are large hospitals with university, more than 1,000 beds, and some other factors of the research that all of us have to be in the alliance. From the beginning, more or less from the beginning, Karolinska and Vall d'Hebron were the first 2 hospitals where the initiative was created, and it has been stable, the number of hospitals since in the last 4 years. Well, the EU has vision to build a network of sustainable healthcare ecosystems. These 4 elements, I think, that are important to understand what we try to do when we meet and in all the groups that are working in the different the teams that works in the alliance. There are more than about 15-20 groups to share practices and patient outcomes, just oriented to improve the care at the hospitals. The opportunity to exchange international knowledge between staff, the staff of the hospitals, and the clinicians as well, to advise the policymakers on sustainable and excellent health care, and also collaborate in research and development of projects, most of them of innovation. We have a strategic plan for the following 2-3 years. Our lemma is leading by doing, and the 6 objectives that can be summarized in these 4 elements that I've already said. Well, that more or less is a simple line that when we were founded in the year 0, the things that we were focused at that moment was to develop vision, to identify the founding members, the memorandum of understanding to set the basis of the alliance and the cooperation, and create a steering committee that in fact is the committee most important, that's the ones that has the real work to make the objectives real, possible. And to employ a project manager. That was very important. Without the project manager, probably the alliance will not function as well as we would like. Then the first 2 years, it was more operational, to start the projects, to empower the staff, to inclusive all members to be really included in and involved in the alliance. And we decided the presidency was rotate. Now, at this moment, I'm the president of the alliance, but this morning I have handed out the presidency to Leuven, and every 6 months, like the European Commissions, we change the presidency of the alliance. And now the main objectives from the year 4 and 5, where we are now this moment. We have to develop this first strategic plan. We are at this moment to develop the projects, to evaluate the main projects, and develop the long-term sustainability of the alliance. We talk. These are the different. I have told already that the different. Working groups, more than 350 professionals of the 9 hospitals that are involved in these projects. You can be grouped in more or less in 3 ambits: the healthcare, research and education, and strategy and management. More or less, they have the same groups in these 3 different topics. Some examples, I don't have time now, but some examples of projects that are going on and with some results. It's about clinical trials, European clinical trials. The European Union deals this project. The projects of benchmark between us, for example, the COVID care and breast cancer and some others. Another project, important project with gene therapy, like CAR-T, that we are collaborating with these hospitals of the Charité and Erasmus and others of the alliance. And till now we have achieved more than 30 million from the European funded projects. This is one of I think this is one of the strengths of the alliance. We have made during COVID times policy statements to the European politicians, and also the lessons we learned. Some lessons that we are not so different. We could think what the difference between a Spanish or Catalan hospital with a hospital of Sweden, or from Belgium or a German hospital. I mean, when we stay together, in fact, there are no such difference in culture or on the same way of, I would say, the way of having the problems or facing the problems of our hospitals and the healthcare in general. Start with the vision and empower our people to realize it, and also for the staff members, the staff members of the different hospitals, it's an opportunity to develop professionals also, I think. And just to conclude, if we stand stronger together. This is I would say the final conclusion, that we stand stronger together to face our shared challenges. That will be the conclusion, that our experience of these few years of the Alliance, we could say that we are happy, all of us, and we are glad to have started this experience. And now what we really need now is to concrete the projects that are going on in the following year or 2 years, and that give us this opportunity for achieving some important projects at European level that, as I've said at the beginning of the session, otherwise one hospital alone would be very difficult to get. And finally, this is another project that Dr. Seoane, the last speaker of the session, we will explain to you with detail, the Healthcare Transformation Academy, that it's a project that it's focused on train of our staff in the latest healthcare developments. So also is a project that it is included in the alliance of the IUJA. So thank you very much for your attention, and that's all, Ruben.